Hi, this is Leah Darling, physical therapist here in Scottsdale, Arizona. I'm going to talk about the myofascial cupping this week. We talked about myofascial taping and kinesiotaping last week. So this week we're going to talk about cupping. Cupping's been around for about 5,000 years. What it's used for primarily is a couple things. It creates like a lift in the tissue, which can help create space and decompression. It also brings fresh blood into that area, which can help with healing. So the type of cups that I use are a silicone cup, and I do the dry static cupping. There's other types of cupping, but that's the type of cupping we're going to talk about today. So I use the rock tape cups, which are silicone. So my client today gracefully let me use her as a subject. She's an avid marathon runner, qualified for Boston. So we're working on a little bit of hamstring flexibility today. So there's a couple different ways you can apply the cups. You can apply them the plunger way, which is just to push. I use the more aggressive way for her as I turn them inside out and place them along the hamstring where she's having the tightness or the pain. With the silicone cups, you leave these cups on for about 90 seconds. Other types of cupping with glass, you can leave them on for a few minutes, but with the silicone ones or the rock tape ones, we leave them on for 90 seconds. So I'm just placing them all along the hamstring. So there's a couple different ways you can use them. So when I'm starting with someone, I just do the static method, which you just put them on and leave them. So that's kind of level 1 as far as treatment. Level 2 is mobilizing the cups. So I'm going to kind of bring it back and forth, up and down, and then clockwise and counterclockwise. And what that does is it just creates a little bit more lift underneath the cup. So we're just mobilizing each one of these. And I would just continue down. And then what happens sometimes is it may leave like a red ring, and that just really means that that area was more restricted and lots of fresh blood has been brought into that area, because we usually break the capillaries with the cupping, which doesn't damage the tissue. It just creates a chemical change. So if you have any questions about myofascial cupping or feel like it's something that you need in your treatment program, I'd be happy to help.